Welcome back to Maverick Beat as we continue to explore the development of digital healthcare in the second part of Got Digital, redefining how we deliver healthcare. Now let's head to Nairobi, where PSI's Global Digital Hub is headquartered. When it comes to phones and tablets, we often pay most attention to the stuff that we can see on screen. User interfaces, apps, real-life moments captured through a camera's lens. But we all know that it's what's on the inside that really counts. Behind every digital interaction is a whole system of people and operations that keep things connected and working. PSI launched its strategy for consumer-powered healthcare in 2018, called Connecting with Sarah, allowing Sarah to engage directly with her healthcare, particularly through her mobile phone. This has never been about new flashy technology or exclusive digital interventions. This is, as its name implies, about Sarah, and finding the most streamlined, efficient, and trustworthy ways for her to get high-quality health information delivered through the mobile platforms and apps that she is already using in her day-to-day. In this segment, we meet Chris Purdy, Deputy Director for Digital Health at PSI, Terry Mathenge, Program Manager, Susan Letting, Digital Product Manager, and Malcolm Quigley, who is joining on behalf of an anonymous Maverick member. They will discuss how this bold investment in building PSI's digital backbone allowed us to develop scalable solutions for Sarah, health providers, and back-end system optimizers, all the while moving a global headquarters to Kenya in order to be physically closer and therefore more responsive to the work and impact. Let's tune in.
I'm Chris Purdy. I'm the Deputy Director of PSI's Digital Health and Monitoring Department, and I help to provide technical direction and strategy for PSI's digital health implementations across the global network with a particular focus on consumer digital health.
So my name is Terry Mathenge, and I'm a Program Manager, part of the Digital Health and Monitoring Department based in Nairobi. My role involves overseeing the implementation of digital health solutions across multiple countries within the PSI network.
So my name is Malcolm Quigley, and I'm the Deputy Director for Strategic Partnerships within the Global Fundraising Department of PSI. And I acted as a Maverick Collective advisor on this particular project with the Maverick Collective member.
My name is Susan Letting. I'm the Digital Product Manager at PSI's Digital Health and Monitoring Department. So my role in the project revolves around three main aspects. That's requirement gathering and documentation, system configuration, and particularly for the workforce-facing application, and overseeing the rollout and scale-up of those tools and platforms for our workforce in the field. So I'm excited about this project. It's very important for us because it enables us to deliver solutions or platforms that help our health workforce in the field to improve the quality and efficiency of the healthcare delivery as they go about their field operations and activities.
Connecting with Sarah project was really born out of this vision that PSI had for consumer-powered digital health, and to bring care closer to our target consumer, Sarah, our archetype that we serve in so many different markets around the world and in so many different health areas. And the real goal of this project to connect with Sarah to power up her health engagement through her engagement with mobile was really aligned with PSI's digital strategy vision to improve consumer health and well-being using technology. And the real focus and objectives for this project were to really optimize the technology that PSI was using to deliver these interventions for scale from a technology perspective, but then also from a capacity perspective to actually have the team and the resources and the skills to actually extend these tools to PSI's global network and to be able to sustain and scale those approaches.
Before the Connecting with Sarah project, we didn't have the bandwidth to go to the field and carry out user studies. So it was more of technology driven than user driven. So as much as we would gather requirements to develop solutions, it didn't involve the user as much as we wanted to. But now with the Connecting with Server project, you are able to go to the ground and carry out the user studies to the depth and level to which we thought we would then be able to identify or define the problem that Sarah was facing and resolve it.
We developed the app to sort of just collect data on the ground. But since the member came on board, we were able to have a more robust engine that would allow us to use other user interfaces to interact with Sarah. And this meant their messaging platforms such as WhatsApp and Facebook. And this allowed us to sort of break barriers that the girls were experiencing in terms of interacting with a provider. They felt embarrassed to ask questions and they felt judged. So for privacy and confidentiality, they felt if they could interact with a chatbot, which was a system, then their needs would be addressed. And also the challenge of not getting all the information they were looking for on the internet. Sometimes it was conflicting. It was not in one source, it wasn't credible enough. And sort of meeting these needs that the girls on the ground were telling us were their challenges is what helped us come up with chatbots, and which is mainly a text-based interface where the girls are able to get information and we're able to signpost them to youth-friendly service providers to take up contraceptive methods.
The current pandemic has shown us the role of digital in providing healthcare and how it has really facilitated Sarah to take control of her own health. Because if we look at the way that we were able to connect with WhatsApp and deliver remote training to community health workers, that wouldn't have been possible a couple of years ago before we started all of this work. And now we're able to deliver remote training in a way that actually the community health workers prefer. The satisfaction rate with that level of training is so much higher, and also we're seeing that it's a much higher retention rate, and it bears true. They can access the training on demand when they want it, where they want it, and go back over it again if they need to when they want. And so that makes it so much more accessible and better in terms of the overall outcome of their particular work and the quality of what they deliver.
We reached, as part of this project, over 1.3 million clients with the tools that we developed in this project in 17 countries. And of those, over 600,000 actually came forward and actually took up health services. One being the Workforce app, which was a tool that we developed to help link clients to care from outreach to providers using e-referrals and really strengthening that process and making it much more efficient to actually facilitate that linkage from the community to the provider and actually be able to track how effective we were doing that work in real time. And another key product for us are location services. So tools for the client to understand what outlets provide high quality services close to them. So it could be health products, it could be an HIV self-testing kit, or accessing contraception services, and really being able to signpost them digitally to those outlets that are close to them. We saw Nairobi as this really emerging and rapidly growing technology hub in East Africa as an opportunity to really base our capacity and our team there and really be much more responsive to our country teams and really leverage all of the capacity there versus being reliant on headquarters staff. It's been much more scalable and in the course of the project, we recruited a team of 6 people based in Nairobi, Susan and Terry being among the founding members of the team. All of the people that we initially recruited on the project are still with us to this day and are among the highest performing members of the entire digital hub, which I think is a testament to the strong people that we've recruited, but also the continued need for this type of support. And we've even extended it, the size of our digital footprint in the hub to over 20 staff now that are based there and really basing PSI's global efforts for digital health out of Nairobi. these tools and these approaches that we're continuing to scale and are continuing to grow in the years ahead, and are responding to PSI's digital strategy vision and that post-pandemic future that Malcolm spoke about earlier, where these priorities are more important now, more so than ever.
So in terms of what next and where we want to be in the near future or in the long term, I think there's a well thought out strategy on what we exactly want to do going forward in terms of scalability and sustainability, basically around building sustainable strategic partnerships with industry players, issues around open source adaptation and development, and basically positioning our tools as global goods which can be used by other people in the industry.
Working with a member who allows you to be honest and vulnerable with the challenges that you're actually experiencing on the ground allows you to be more innovative, because you're sharing the adversity you're facing and we need to figure out a solution. And so she gave us that space to be free and talk about what was going on. And, coupled with her experience, her previous experience, we were able to discuss and come up with innovative solutions to move us forward. So it was really refreshing to work with someone who's willing to take on challenges and learn with us, because we knew from the very beginning we did not have the answers. So it's going to be an adaptive process.
When it comes to Maverick Collective projects, in my mind, there are three truths. One is that we're going to do something different. We're going to do something innovative, and we're going to do something that's never been tried before. And that's certainly the case in this instance. Having a Maverick Collective member on the team who has the level of experience that our member in this case had is invaluable, because it brings a whole level of thinking and new approach that really challenges us and gets us to where we want to go. The second truth is that everything's going to go wrong. We're going to fail in some way or another along the journey, and that's fine. We want that to happen, because that's when we learn, and that's when we innovate, and that's when we actually prevail and create the solution that we want to arrive at. And this project is testament to that. We've had lots of different challenges along the road, and we've come at the other end, and we're in a much better place. And I think the third is the one that underlines the innovation and the value add is communication. Having a really integrated team, and in this instance we met very regularly. We had several, we had every 2 to 3 weeks we would meet as a team, and we shared all our challenges, all of the things that were going wrong, all the things that were going well, of course, and I think that level of communication and integration with our Maverick Collective member meant that we were able to pivot.
It's rare that a donor comes along saying that they want to fund the back-end operations of something, the architecture that most of us never see. Here we have a Maverick member that was not only willing, but completely passionate about making digital systems work for Sarah, for health providers, and for scale. What's so incredible about this type of funding is that it allowed us to work on the cross-cutting capacity of systems, so that what works for community health workers in Mozambique can also work for cyber educators in Latin America. This type of rapid and cost-effective replication of system solutions is paramount for accelerating progress toward universal healthcare. This project sparked a movement for global digital health headquartered in Nairobi and serving the world. A movement for centering consumers, not the technology, when it comes to advancing health through digital innovation. A movement for more trusting, private, and accessible ways for women and girls to access sensitive health information and get their deepest questions answered without stigma or shame. A movement for more philanthropists like this Maverick member to provide catalytic funding to build a core function of an organization and to be such a critical thought partner and collaborator the whole way through. Terry, Susan, Chris, and Malcolm, thank you so much for sharing this incredible story with us and for your relentless work and activism to bring more digital health solutions to the world. To our dear Maverick Collective member and friend, thank you for all that you have invested in this project, way beyond the checkbook. Your unwavering support and partnership has been invaluable. We are living through an unprecedented moment of opportunity in the digital age. Digital connectivity is rapidly increasing across the world, and especially in low and middle income countries. The world has witnessed the fragility of most health systems and the urgent need for innovation. Digital healthcare solutions have never felt so important for progress. Through both of these projects, we have seen the catalytic impact that a single philanthropic investment can make in developing systems that can be used across many geographies by different types of health workers and users, and for any health reason. Thank you for tuning in to our third episode of Maverick Beat. It is an honor to host you on this virtual journey and to witness the impact that Maverick Collective and PSI are having on women and girls, you, and philanthropy. See you soon.